Good morning, good afternoon, good evening, wherever you are at this time listening in. Welcome to Delivering NCD Service Series. And we're on to number 2 here, where we're looking at prioritizing non-communicable disease in National UHC Benefit Package. My name is Dr. Waqanivalu. I work for the Non-Communicable Disease Department here in WHO headquarters in Geneva. Now, I've said in the last series that your national NCD action plan needs to be translated into national service package. You'll see here why. The NCD services in the last UHC monitoring report, there's been quite a lagging behind in the services. If you look at the non-communicable disease line, it's relatively flat compared to other programs. So we've got a bit of way to go in terms of services, and the topic today is part of that journey to strengthen this. We've said this in the last time as well, integrating NCD into primary health care. It will take the strengthening of the different systems component in order to deliver the integrated NCD services at the community for the people that we are targeting. And today we are focusing particularly on how do we then translate NCD plan into UA services included in the UHC benefit package. But this slide shows you the different components and the support that WHO is providing for the countries in order to make the system strengthen to deliver NCD services. Now, what is National UHC benefit package? Sometimes you'll see also it's called National Essential Service Package, National Basic Package, but it's basically a set of publicly financed, evidence-informed, prioritized individual and population-based intervention. The keywords are bolded there because we don't just need a list of services that you are required to be delivered in the countries and have funded for it, but it needs to be evidence-informed and publicly financed. That's the key to it. And so we need to ensure that non-communicable disease services are actually included in the UHC benefit package or National Essential Package if we hope that this could actually be then delivered. Now, in developing the National UHC benefit package, there's a 3D priority setting tool that WHO has. It begins with data collection and analysis, both in terms of burden, cost effectiveness, budget impact, financial risk protection. These are all important components that you collect and analyze the data and then have a dialogue to establish legitimacy and be transparent about the process of ultimately then deciding which services are going to be prioritized for a country to deliver on the limited budget that each of the country has. So this is the important process that you need to be engaged with and ensure that NCD is actually prioritized in there. There is a tool that has been developed by WHO to use for this, and it's called the UHC Compendium. This is a high-profile product with multiple interfaces, consists of listing of services, which includes non-communicable disease, but also have a repository or a resource that reflects the cost in terms of infrastructure, the cost in terms of medicine, the cost in terms of the workforce in order to deliver those services and action. So that is being developed in WHO, and you'll see here in this next slide some of the NCD services that are initially been put in there with this workforce and medicines and infrastructure implication for you to use at the country level. With that tool available, the process to undertake at the country level is important, and I'm showing here the example of how it is used in Ethiopia. If you look at the diagram, when you look at that cycle of the data analysis and all of that, then I've put in there the traffic light to show that there are some interventions that are just not cost effective and probably shouldn't be included in the package. Then there are those that probably need more information in order to establish their effectiveness in order to then include, but then there are those that are greened that really this has gone through that analysis and should be prioritized. And you'll see on some of the process and sources of data that Ethiopia has undertook to actually arrive at their list of interventions. So it's been done in countries, and we encourage you to to do that as well in yours. Now, what can you do? You can advocate for the prioritization of NCD services in National Benefit or Essential Service Package. You can actually act and engage with benefit package design process for prioritization of NCD services in the country. You need to be engaged with that process if we will have a non-communicable disease be actually listed and prioritized. And ultimately, you can influence or make decisions in order to prioritize NCD services with the entitlements. Now, if that is done, then we are really on the road to having services delivered, not just at central level, but really scaled out into the periphery, into the very extreme of contexts and situations. So that, in a nutshell, is that prioritization process, and we hope this will help you to be on that path towards ensuring services are delivered to those who need it most. Thank you for your attention. There's an address down below for you to contact us if you need more information or if you have questions. Otherwise, you can be on the lookout for the next session that we will be delivering on the other components of the health system, all in order to be able to then deliver on NCD services. Thank you very much.